Good morning, good afternoon, everyone. Welcome. As always, curious to know where people are filing in from. What city, what state, which clinics? Who do we have on the webinar this afternoon? Let us know in the chat if you are connected. And Janet, where are you coming to us from this afternoon?
I'm, I'm on the East Coast in Connecticut,
Nice.
in the hills of Connecticut.
The hills of Connecticut.
Mhm.
There's usually a lot of East Coast folks on the webinar, so you'll have people in close proximity.
Yeah, we're all enjoying the sun for a change.
Finally. Yeah,
Yeah.
excellent. Welcome again, everyone. Okay, so we'll kick things off here, and others can file in as the session continues. We have a jam-packed session today, 45 minutes of great content, and really excited to be joined by Janet Marlow, who I'll introduce in a moment. But today's session is going to be focused on the sensory exam room. I know a lot of you have already read the topic and description, but we're going to be taking a look at why hearing is one of the primary senses that's often overlooked in a standard wellness exam. There's some really exciting screening data that Janet's going to share with us. And then, as always, we try to end these webinars with some practical tools that you can begin to use in clinic right away. So there's several really helpful resources here that are going to be complementary that you all can start using in practice as early as tomorrow. So to walk us through this topic, I'm really excited to introduce Janet Marlow. She's the founder and CEO of Pet Acoustics. And a certified sound behaviorist. Janet's been deep in the research on this topic over the last few years. She's an author, and she spent decades bringing biometric and sound-based science into animal care. Um, she's worked with several hundred clinics, done thousands of hearing assessments across a number of organizations and across 4 countries. So she really is a perfect host for the webinar this afternoon. And with that, I'll hand it over to Janet to take it from here. But please do ask questions as we go throughout this. We can respond to them in the Q&A at the end of the session. So please do be vocal about any questions you have as we kick this off. So Janet, over to you. Thank you for hosting us today.
Oh, it is my pleasure. Thank you so much, Mike. So today, what we're going to cover 4 areas. First, the sensory exam room itself and why behavior is often a sensory signal. Second, the clinical gap around hearing wellness. And third, a practical 2-minute hearing screening tool that fits easily into workflow. And finally, how hearing awareness and sound conscious care can be integrated into real veterinary practice. So, why this conversation and why now? Well, we're at an inflection point because hearing wellness is very often missing from the wellness exam. And I'm going to be bringing you exactly how to incorporate that into your practice and the reasons why and the benefits. So, even before I continue, I'd like you to understand that um, that the one of the most important concepts I've learned over decades, and I mean decades of studying animal hearing, is that sound comes before behavior. Animals hear first, then react. By the time we see pulling away, resistance, freezing, vocalizing, or reactivity, the nervous system has already responded. So behavior is often not the beginning of the story, but sensory input is the beginning of the story. And watch this cat and watch its ears, because you'll see as the cat hears, then his body engages. But before that, his nervous system has already been experiencing and responding. Here comes the left ear. Oh, there's a sound, another sound. And please keep that in mind as we go through all the experiences of how animals experience your exam room in a sensory way. So the body responds to sound before conscious processing even occurs. In clinics, we have doors opening. I have some examples of that. Doors opening, metal bowls, phones, alarms, barking dogs, HVAC systems, slippery floors, and echoes from hard surfaces. Animals process all of this with the hearing that is significantly more sensitive than ours. So when stress physiological rises in the exam room, the soundscape is often playing a major role. So cats and dogs are not hearing the same room we are hearing. Cats detect frequencies up to 64,000 hertz and dogs up to 45,000 hertz. You can see our cap is 20,000 hertz. And many of these, that what this means is there are sounds in the clinical environment we may never perceive, but our patients absolutely do. And beyond species differences, age, breed, and individual physiology all influence hearing ability. And that's why individual hearing screening matters. This is an important chart. In practice, behavior becomes the signal we notice first. Startling, freezing, resistance, lunging, shutdown, pulling away, or what owners describe as ignoring. But many of these responses can have a sensory component. A hearing change can completely alter how an animal navigates space, processes handling, or responds to verbal cues. So let's talk about the clinical gap itself. We routinely assess vision, cardiac function, and dental health, among others. Yet hearing, one of the most primary senses shaping behavior and safety, is typically not screened during wellness care. Now, I know there are many of you that do use clapping or dropping a bowl or clicking behind the ear. Um, and then there's, of course, the BAER test. But there was nothing in between those two practices. Um, and the absence becomes even more important when we consider how often hearing changes are mistaken for behavioral changes and problems in aging. So we've done over 10,000 screenings. It's probably up to 20,000 by now, completed across multiple organizations and countries, including clinical hospitals, universities, rehabilitation programs, and working dog organizations. So this is no longer a theoretical discussion. We're beginning to gather meaningful real-world data around hearing wellness. One of the most surprising findings has been that nearly 1 in 2 animals screened showed some degree of hearing change. Most of those pets had never previously been assessed. That tells us there is a significant amount of undetected hearing loss in the general pet population. We generally see three categories of results: normal hearing, frequency hearing loss, and more significantly, broad range hearing loss. Each category creates a different conversation with the pet parent. Even frequency-specific loss can explain selective responsiveness that owners may interpret as stubbornness or disobedience. When hearing changes go undetected, it affects handling, communication, stress responses, and owner interpretation of behavior. Once owners understand there may be a sensory explanation, the relationship often changes immediately from frustration to empathy. So let's take a look at the 2-minute tool so that you can see for yourself how simple it is. The process of this hearing test is intentionally very simple. First, we observe involuntary responses such as ear movement, eye shift, or head turning. Then we trigger calibrated tones through the smartphone app. We record frequency responses and repeat over time during wellness visits. The goal is not perfection the first time. It's creating a behavioral hearing baseline that becomes clinically useful longitudinally. So this is a video of the 2-minute test with a black lab in a veterinary clinic. And this is the onboarding. And then you will see the lab respond to high frequency sounds, then mid frequency, and then low frequency sounds. And very often you will see, especially in a senior exam where they'll say, my dog doesn't hear a thing, they will be able to realize that the dog actually has low frequency hearing, and that changes everything at home. So here is the exam. You're going to hear animal sounds, but behind the animal sounds are sine waves that the dog is actually responding to. So here we go.
Then begin the test. Select the dog's name in, put the date of birth in.
And then I'm going to tap the high frequency hearing. Now the mid frequency. And now low frequency. And then within 15 seconds, you receive a clinical PDF with the responses that you have input. And I want to show you a second video of a puppy in the same clinic was suspected of not hearing at all, a completely deaf dog. And I brought over the pet hearing test so that they could affirm, yes, indeed, the dog was deaf. Same sounds. But not react. The pet does not. So here's the crickets. And you're very close to the dog's ears, and it's not responding. No. That was very helpful to them to be able to explain to the pet parent that their dog is indeed deaf, and that changes the whole trajectory of that dog's life. So why this fits into what you already do. This was designed specifically to avoid disrupting workflow. Very important. The screening takes only a few minutes, requires no sedation, no equipment purchase, and no specialized room. The result generates a PDF report that can be attached to the patient record and referenced during future wellness visits. And beyond screening, sound itself becomes part of patient care design. Before the visit, species-specific sound therapy, which Pet Acoustics also provides, can lower arousal during travel and waiting. During handling, targeted sound can support calmer procedures, and after procedures, recovery and boarding environments can benefit from more acoustically supportive conditions. So I am part of a feline medicalization gap where we're now using the sound therapy to go from the home to the crate to the car to the lobby to the exam room so that by the time the cat is in before the veterinarian, their cortisol level is not off the charts. And we're having much success with that. So here's an example of the Fidelco Guide Dog Foundation utilizing our sound therapy and how quickly it demonstrates that the auditory environment can influence behavior. What matters is not simply the music itself, but how sound is engineered for the way animals actually hear and process auditory information. So these were two highly stressed German Shepherds, and I just placed the sound therapy in a small speaker in front of them, and in 2 minutes, you will see their behavior completely change. This is 1 minute for one dog. 2 minutes later, the second dog. And that was it. Kind of a very simple, elegant, non-invasive method. So how would you apply that in your clinic? Wellness visits. Puppy and kitten visits are an ideal opportunity to establish a hearing baseline early in life. Just as we document weight or dental condition, hearing can become part of the wellness record. It also changes the emotional tone of the visit because pet parents feel they are receiving more complete sensory care. In senior pets, hearing loss is frequently mistaken for aging, stubbornness, cognitive decline, or anxiety, but often the sensory world itself is changing. Once we identify hearing loss, it reframes how we support the patient and how owners can interpret behavior at home. One of the reasons this integrates well clinically is because the conversation is very natural. You simply position hearing as another wellness measure. While running the screening, you narrate what you're observing, and then you translate the result into everyday language the owner immediately understands. So, for example, you would say, we check vision, dental, and heart at every wellness visit. Today, I'd also like to check Bella's hearing. It's a 2-minute test and tells us a lot about behaviors you might be seeing at home. Excuse me, I'm going to have a little sip. And then at the end, you can say her high frequency response is reduced. That's why she may seem to ignore you when you call from the next room. So literally, it isn't hearing you at all. And here's what it means going forward. So this is not only beneficial clinically, but operationally. It differentiates the practice, strengthens long-term wellness relationships, improves behavior conversations, and may reduce fear-free based handling challenges. It also changes meaningful new wellness touchpoint that clients genuinely value. So what becomes powerful over time is the longitudinal record. A hearing baseline at age 2 becomes incredibly valuable at age 7, 10, and 13. Hearing wellness starts functioning like any other tracked clinical metric. And here's a veterinarian talking about the
I'm
hearing
doing a
test.
2-minute hearing wellness screening using the Pet Acoustics Plus app. After entering the patient information, the app presents a sequence of high, mid, and low frequency hearing tests, specifically engineered for how dogs and cats naturally hear. As each frequency is presented, I will observe the pet's hearing responsiveness through ear movement, head turning, eye focus, and behavioral reaction. The screening evaluates responsiveness across multiple hearing ranges and helps identify possible hearing sensitivity or early hearing impairment. Within a minute, the results are available along with hearing wellness recommendations and sensory support guidance. I'm excited to have a new layer of preventive sensory wellness within the veterinary exam experience.
So my goal is for this to feel practical and immediately usable. We want you leaving today with a workflow, a communication script, and a simple way to begin integrating hearing awareness into veterinary routine care. So I'd love to hear your questions, thoughts, or clinical observations. Many of the most important conversations around hearing wellness are just beginning in veterinary medicine. So I think we can open that up to some questions and would love to answer.
Yeah, excellent. Thank you, Janet. As we wait for a couple of questions to pop in here, I'm curious about the study that you all conducted. I know there were 10,000 plus screenings there. Can you tell us a bit more about that? How that data was acquired, and maybe some of the surprising findings that you came across when doing that study? I think it was on your seventh or eighth slide there, but
Yes.
obviously a ton of great information. So would love to hear more about that study.
Yes. So we were able to, we have had many people do the hearing test, and we selected mostly veterinary facilities and dog or canine organizations, um, feline veterinary hospitals, so that we were able to really collect their data of doing the test. And we did discover that there was a very common drop from high frequency to impaired hearing, that dogs and cats actually paralleled from puppy to geriatric ages. Uh, what was surprising was how many dogs and cats had some level of hearing loss. Mostly the high frequency is the first to go, just like in humans.
Mm,
And the point of it is that behaviorally, if the knowledge of knowing that a dog has impaired hearing, even at 7 years old, like for example, one of the dogs was a border collie, 7-year-old named Archer, who had been traveling, had been taken to behaviorist after behaviorist to try to help the pet parent understand why the behavior had changed, and they tried everything they could not alter. That the dog wasn't listening, it had startle reflex, and that it was also not behavior. It was fear aggression on the street. They did the hearing test in 2 minutes and learned that the dog had lost most of its hearing.
mm.
And that completely changed the behaviorist and veterinary uh, uh, cure for the dog, and help the pet parent understand what to do moving forward. So that's very important, is that, again, going back to that first slide with that first cat, that sound comes before behavior. And that's why hearing assessment is so important in veterinary care.
Makes a lot of sense. And I think a key takeaway that I'm hearing too is just that it's a lot more prevalent. Hearing issues are a lot more prevalent than we realize. While you were speaking, I asked the audience what they're currently doing to test for animal hearing, and a lot of it echoed what you had mentioned earlier in the webinar. So Stephanie mentioned it's really a cursory review right now. A lot of snaps, claps, whistles, and knocks, things
Yes.
that are not necessarily super effective, and that was echoed by Jennifer and Catherine as well. We do have a couple more questions here, Janet, that I want to get your opinion on. So,
Sure.
um, Heather asked, what are the best practices around treating or managing hearing loss in animals? What are the next steps after you have the results?
Okay. So the we have a document that addresses different levels of hearing loss and what to do and how to set up the home. Because for the veterinarian has to be the guide for the pet parent after the hearing screening has been done, because the pet parent will say, well, what do I do now? And so we offer a lot of guidance, documentation on that based on what the hearing frequency loss looks like. The not so much the breed of the dog or cat, because it really is generic in a lot of ways. Um, but like for example, the puppy that was deaf had to be addressed for the rest of its life, and we supplied the clinic with a very in-depth uh, practice for the pet parent to how do you set up the home, where not to go behind the dog, when you're to create a startle reflex. So it's a very integrated um, behavior between the pet parent and the pet itself. So we do provide a lot of that information because it's like, well, what do you do now? But so we provide that other half.
Gotcha, that's helpful. And I think that addresses Ali's
Mm.
question as well. Ali mentioned that she downloaded the app. Is there a version available for office use? She mentioned that it takes time to put all the info in for every pet, and that can be a limiting factor after you do the test. So curious to know what your thoughts are on that, or if there are any shortcuts or workarounds.
Well, not at the moment, but what our goal is especially as we love Digitail, is to be able to have this in the PIMS workflow, so that it becomes a part of the wellness exam, because Pet Acoustics and myself, as a sound behaviorist, have been working to reach this goal where the veterinary world and hearing wellness is now meeting, and that is what our goal is to get into your workflow. Uh, at the moment, this is what is available, but we're working on other ways so that a veterinary clinic can onboard and have this available to many pets at the same time. Yeah, but I understand. Uh, yeah, but we're just at that inflection point, so we're working as fast as we can to make it all possible.
Yeah, so stay tuned on that one. More to come. And then Catherine asked, have you tried this on patients who have already lost their hearing? Let's say, I think it's ototoxicity patients, and compared any regaining of hearing.
Um, yes, we have, and we have discovered that most of the dogs or cats have some form of low hearing, and that's because they feel vibration. So they will respond to the vibration of the low tones. And that's an important thing to know because one, that may cause their behavior to be fearful in a vet's exam room table because of the vibration of the metal. And it may not be because of behavior, but it might be because they're oversensitive to the vibration. Um, and that also is important in the home because there's heating vibrations, there's air conditioning vibrations, so that has to be addressed. I wanted to share some a tool that is really fantastic with your audience. I have you can download a decibel app. And this is such a fantastic tool that you can do right away. So there's a decibel meter. Um, I use one that's actually called decibel meter. And you can, here's the decibel meter. This is just one. They're all free on the, and you can go around your clinic and find the spaces that are the loudest and try to mitigate the that volume. um, is it the door slamming? Is it the
Mm.
beeps of the surgery room? Is it the cattery kennel? Is it your lobby? Pet Acoustics addresses all of this, the facility noise function, and you can utilize a dB meter to discover that for yourselves. And it's very valuable. You probably know it intuitively already, but if you get the data from the dB meter, you can really start to have your staff acknowledge where those pockets of excessive volume is affecting the pets in your care.
Awesome. And I love how practical that is as well. Again, we'll summarize the free resources here so that you all have access to them afterwards, but really
Yes,
like that last tip, Janet. We have
thank
a few
you.
more questions here. So there's one from Jennifer on how do you describe the difference between this and bear to owners?
Well, um, so I innovated this screening test, and about 3 years ago, I did a deep dive into the BAER test, and even though well, first of all, you don't need any sedation. This is the most non-invasive way, and I know I'm going to be refining the test as time goes on, but for now, this is the most non-invasive way to allow a pet parent and a veterinarian, like for a pet parent to do the hearing test at home where the pet is the most comfortable and feels the safest to do the hearing test, receive the email data, and then to bring that data accordingly into the vet and say, hey, I did this test as you're examining my cat. You can see that there's some high frequency loss. What do we do now? So it becomes a communication and an ease for the pet parent. Um, to go to a BAER test costs, I think, about $350. Um, it is it's got to peak, excuse me, the stress level of the pet to go into this unusual environment and to have sensors put on, even though it can be very accurate in terms of the electrical responses to sound. I think it could be pretty terrifying for a dog or a cat. I have many veterinarian friends that use it, but I wanted to have something to offer between the claps and the BAER test because there was nothing. There was nothing, and hearing is my world. So that's kind of my answer to the BAER test. I think that this, I have almost 50,000 people worldwide having done the hearing test already, and the data is very important. And there's a lot of common data to assess. Um, and I don't know about the BAER test's evaluation in terms of data on a large scale. So we're very interested in getting global, like a biobank on hearing. Um, so.
Yeah, appreciate that. And I'll come back to Stephanie's question in a second, but I'll ask you one from Andrea, which is related. I think you've answered the bulk of this in your last comments around how the pet acoustics test can assuage or mollify animals more than some of the typical tests out there. But Andrea asks, what are some of the limitations of this app or specific clinical scenarios? For example, it seems like a very fearful patient may not respond as naturally if they're hypervigilant or showing significant avoidance behaviors. So
Yeah.
more around some of the limitations if you've come across any.
Well, I'm going to go back to my first slide, which is even if the animal is fearful and is cowering, no matter what the behavior is, the sound is still going to have the same effect. And it will not, it's like its instinct will not be able to behaviorally block the response to the sound. Because as you know, sound is a pressure in a dog's ear, and it will still trigger the brain's response uh, to each of the frequencies. So it kind of bypasses behavior. Um, and so we recommend the sound therapy on the app to, or one of our Bluetooth speakers, to modify if you know that you have a dog that's going to be fearful for the exam, to again, just like our feline friend going from the home into the exam room, that they use the sound therapy because we have proven through biometrics that the music, which is not spa music and which is not classical music, because we've actually proven that biometrically. Um, uh, I was very lucky to have had Dr. Temple Grandin call me on the phone one day. Can you imagine getting a phone call from her and her saying, Janet, you should prove that your music is biometrically better than classical music in a clinical setting. And of course, I said, yes, of course I will. And I did prove that. And by the way, all my research papers that are published and peer reviewed are on our Pet Acoustics website, and be very happy to share that with Mike to share with you. Um, and so now I've lost my train of thought on that one question. Uh,
No, but I think you covered it, Janet. That
okay,
was yeah, that was well
okay,
answered. We do
okay.
have an interesting question here that I'm fascinated by as well. It might be very specific that you have to follow up with afterwards, but you can let us know. Stephanie's asking what frequency was used to help calm the two German Shepherds.
Okay, that's such a great question. Okay, so I have that data, um, and it's not a specific frequency; it's a frequency range. So I'm going to go back to my original chart. Okay, so um, think of it this way: you have a mid-range. So when the dogs, the German Shepherd dogs, hear sounds for the cement walls, people closing doors, that shot of volume, that triggers fight or flight in their ear. That's what happens. That's why why sound therapy is so important, because it brings a median hertz level to an environment. Um, so so the range of the music sounds are within the mid-range of the dog's hearing. Um, I have a proprietary process that I follow in regards to how I compose. So before this life as a sound therapist and leader of hearing wellness as a category, I was a jazz and classical recording artist, and I have my own radio station on Spotify. I'm kind of proud to say all my albums, but that was way before this world, because I've been doing this for 25 years. And all my dogs and cats came to my side when I practiced for performances. And I was deeply curious about why they were so profoundly, their mu muscles were much more deeply relaxed than just, sitting in a bed. And I spent time researching what was available in terms of data of frequencies and decibels, and because I was able to I'm fifth generation classical musician, my family, and I understand how wonderful classical music is, but Mozart did not write music for dogs and cats. And so because I'm a digital recording artist, I was able to come up with a recipe for each species to have the music fit into that wonderful mid-range, and altering notes and all kinds of things and phrasing and making the experience of immersing a dog in the correct sonic environment to release tension and stress. I'm fear-free endorsed, for better health, because we know stress leads to illness in animals and in humans. Um, and um, and it's been used globally for many, 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 many years. So I'm proud to say, Stephanie, thank you very much for that question so that I could answer you in this way. I hope I answered it for you.
Yeah, with a very interesting background. That is a fascinating part of your story, and helpful to see the data here as well. But I recognize there's some secret sauce in the frequency used for different animals as well. And I think all of that is available in the Pet Acoustics app. This seems to be related. Ali was questioning her own hearing while playing the app because she's downloaded and played a few sounds and has tested it and said that there's no sound playing. But I'm imagining that those sounds might only be perceptible to animals. Is that true, or might there be a technical difficulty that she's experiencing?
Make sure your ringer is off. Make sure your ringer is on, excuse me. So I've had that happen a lot with people. There is sound. It's very apparent. Every human should be able to hear it. So it's probably some setting in your smartphone. Yeah. So please know that it is
It's
very
audible. It's audible
it's
to
audible.
humans.
Yeah, it's
Okay,
audible.
good to know.
And that's interesting because we kind of grew up in our societies saying, everything about the dog whistle, which is above our human hearing. That's our above human hearing. So a lot of people think sometimes when you do music for animals that that the human can't hear it. But no, their range should be within human hearing. Uh, yeah, for the best.
Excellent. And that
That's right.
that seemed to do the trick. The volume was
Okay.
up, but Ali's ringer was off, so back on
Oh,
track.
good, good,
Um,
good, good.
Excellent. Yeah, I think that closes out most of the questions that we have in the Q&A. I hope I got to everyone's. I'm just going to do one quick scroll through to make sure. I know Ali had also asked about if there were published guidelines for the management of hearing loss, which I believe you addressed in one of the earlier questions. Anything to add to that, Janet? Or
Yes, I have a blog where I detail a lot of that, according to what you're interested in. Please look at the Pet Acoustics blog. I also it's all with detailed information. I also have I have a podcast called We're All Ears, Pet Acoustics, We're All Ears. I think I have 43 episodes right now, and also address a lot of information. One of them is how to address veterinary clinics for sound mitigation, which could be very helpful. Um, yes, and I also have a certified sound behaviorist course with 6 very interesting and intense modules with exams, and that's also available on the website. And that would uh, if you had one person to go through the course, they would be graduate with their expertise in sound behavior and would also be able to mitigate sound because they would become acoustic experts and also behavioral experts in regards to sound. So I'm very excited about that. That is a new offering that people are doing around the world.
So, so many helpful resources, which I think answers your question, Catherine. Yes, all of these resources will be packaged and sent out to registrants and attendees right after this. We have two more quick questions for you, Janet, from
Yes.
Heather that seem related. So the first one is, what decibel level and frequencies are you testing? And the follow-up question to that was, how do you know if you're close to the patient's hearing thresholds?
Wow. Wow.
Yeah,
Great.
we often have a very smart audience that joins
Very
these
smart. Very
webinars.
smart. Okay, so let's talk about decibels. So the in your when you do your decibel meter, the range that is the best for hearing comfort is between 50 and 80 decibels. Like for example, in a neonatal unit in a hospital, they make sure that the decibel level is between 40 and 50. So for a dog or a cat to release muscle tension, not have stress, is to be between 50 and 80 decibels. If you can do between 50 and 70 in a room, they are golden. Um, and then there's the hertz level. So that's more complicated and very hard to assess as an average person. Um, it can be done. You can download Hertz levels, but that data is not as concrete as because the Hertz levels will vary greatly from second to second in a room. But if somebody would like to write to me and ask me that question, I'd be very happy to submit some data on that. But the decibel level, you've got it, 50 to 80.
Yeah, 50 to 80.
50 to 80.
Excellent. And it was Heather who had asked the question about the threshold. So we'll follow up with you as well, Heather. She says thank you so much. Excellent. Well, this was extremely informative. It's fun to talk about a topic that is so prevalent yet uh, overlooked. And it's clear that you're doing a lot of great research in this area and writing in this area, Janet. And I know
Thank
I speak on behalf of the audience when we're appreciative of the complementary resources that you're offering post
you.
webinar, and would love to continue the conversation moving forward. So we'll wrap everything up and put it in a nice package for you all. But hope you found today's session helpful. And again, Janet, thank you so much for taking the time to lead us through this important discussion.
It was my pleasure completely. Thank you.
I know, so before we end off here, I know you have a couple slides at the end on how to get in touch with you. Maybe we
Yes.
can fast forward to those just so everyone
Um,
can have your information, and not that it won't be at the end as well, but
yes. Yes. Okay. So here we go. You can just write to me at hello@Pet Acoustics. I read every email and I'd be just very happy to hear and answer any questions. This is my passion and my life, and I really want to make a big difference and bring hearing wellness to the veterinary medical world. So thank you.
wonderful. Thank you, Janet, and thank you all. Take care.
Take care.